Welcome to Vertical Movement PT. I'm Dr. Cindy Kimmy, physical therapist, and today we are going to do a physical therapy routine to help with tennis elbow, also known as lateral epicondylitis. So go ahead and find a comfy place and let's get started. Tennis elbow is one of the most common elbow injuries. When you have tennis elbow, you're going to feel pain on the outside lateral portion of your elbow, so right over here. This happens whenever you overuse your muscles with doing activities that require gripping or extending your wrist. So if you happen to be a mechanical worker or you play tennis, or even if you do a lot of household work, you could go ahead and overuse this muscle and cause the symptoms of tennis elbow. Tennis elbow happens when you overuse the wrist extensor muscles, and they connect in this region right over here called the common extensor tendon origin. The most common muscle to get exacerbated is the extensor carpi radialis brevis, and that muscle is in charge of extension and radial deviation. One little trick I like to use is using athletic tape. So you're going to want to go ahead and get a long piece because you're going to wrap it around your arm. Then you're going to go ahead and from the crease of your elbow, you're going to get 4 fingers, start from the crease of your elbow and go down. Underneath your finger, that's where you're going to wrap the tape. So you're going to go ahead and place the tape right around there, and you want to go ahead and wrap it so there is enough compression. And you can also use, if you have like a tennis elbow strap or you have any sort of like athletic band, you could use that here too. You just want to make sure you don't do this too tight to where you cut the circulation off going to your hands and your hands start getting numb or tingly. And what this does, it helps inhibit the tension of the extensor tendons, of the wrist extensor tendons, and it will give you some relief that you need to relax this area that's hurting. So you can go ahead and keep this on all day as you go ahead and do your activities, and you can change it out daily. This is very important, but when you first have tennis elbow, you want to make sure to go ahead and rest your elbow from any of the activities that first cause the symptoms in the first place. Your body needs the rest, and the reason why this injury happened in the first place is because this area has been overused.
One thing you want to avoid is having a slouch posture and having your head forward. That kind of posture is actually going to contribute to your elbow pain. It's going to cause a lot more stress to that elbow. So making sure that your posture is in an upright position, it's going to save those elbows. Also, you want to keep in mind if you work at a desk or you have a desk job that you do not want to keep your wrist in an extended position but in a neutral position. Next, we're going to go ahead and move on to soft tissue mobilization. Go ahead and grab your fingers, and you're going to do a cross friction across the wrist extensor muscles. You want to especially focus on the lateral epicondyle of the elbow. Next, you're going to go ahead and push down, and this is called a tack and stretch. You're going to tack down those extensor muscles while you're going to flex the wrists down. You can also create a fist, so that way you can go down the whole part of the wrist extensor muscles. And you just want to be nice and gentle. This next one is my favorite. You're going to grab the wrist extensor muscles and you're going to roll it over the radial bone and the ulnar bone. This next technique is pretty similar, but instead you're going to use the other arm to rotate and to cause the mobilization. So you're just going to grab onto those wrist extensor muscles, and then with the other arm, you're going to rotate towards your body. Alright guys, moving on to stretching. We're going to start off with the wrist extensor stretch. You're going to stretch out that arm, use the other arm to add an overpressure. If that's too much, go ahead and lighten it up, or just don't add any overpressure at all. But if it feels pretty good, go ahead and add that overpressure, and you should feel it on the top of your wrist extensors. Just make sure not to overstretch, because you can hurt yourself, especially during the beginning phase of tennis elbow. Next, we're going to go ahead and move on to our next stretch, and that's the wrist flexor stretch. And you're going to go ahead and stretch out that arm, fingers pointed down, palm open forward. You can add that overpressure if it feels good. You should feel that on the top of your wrist flexors. But just keep in mind, you do not want to overstretch or add too much pressure, especially if it hurts, because your muscles and tendons are inflamed right now, and stretching could make it worse. So just be nice and gentle and listen to your body. Moving on, hands behind your head, elbows back, and open up that chest. This exercise is great to mobilize that upper spine as well as open up those chest muscles and stretch them out. This is essential for tennis elbow because you don't want to have that slouch posture, which causes that strain to the forearm muscles as well as the elbow. So this exercise is key. One thing you want to look out for is that low back. You want to make sure you're not overextending in the low back, but you're getting all of your mobilization from the chest and the upper back. You also want to make sure you keep an eye out for your neck. You do not want to overextend from your neck. Remember, you should feel the stretch in your pec muscles as well as your upper back. This butterfly dynamic stretch is going to help you have an upright posture. Moving on next to another thoracic mobilization, grab a yoga mat, or if you have a foam roller, which is better, go ahead and grab that. You could also use a rolled up beach towel, which also works, but if you don't have a foam roller yet, I highly recommend getting one because you literally can do so many things with it for your body. So go ahead and place your hand in the lower part of your head and upper part of your neck. You want to make sure that you're not extending from your neck, but all of the extension is coming from your upper back. You also want to make sure that your lower back is not extending. Your lower back loves to cheat. It loves to steal movement away from the upper back. So keep that core tight and just make sure all of that mobility is coming from the thoracic spine, which is the upper back. This exercise is great to help to improve your posture and to help reduce the amount of pressure that you put on your elbows, and it just gives your wrist extensors a break. So make sure you can do this for about 10 to 20 times slowly and take your time. Moving on to range of motion of ulnar deviation and radial deviation. You just want to move that wrist side to side, getting that movement in there. You just want to make sure that you're not feeling any pain along that lateral portion of your elbow. When your wrist is going inside towards the thumb, that's radial deviation. When it's going out towards the pinky, that's ulnar deviation. You want to do this about 10 times, nice and slow. So this is key to help with the strength of your wrist extensors so they do not get overstrained. First, we're going to start with active range of motion, no weights at all. You shouldn't feel any strain or pain in that outside of your elbow. If you do, you want to limit the amount of range of motion that you're extending and flexing your wrist. Next, we're going to move on to strengthening. You're going to apply a pressure onto your wrist, pushing down, and then you're slowly going to lower your wrist down. This is called eccentric strengthening. When you're strengthening the muscles while it's lengthening, you want to make sure that you do not feel any pain along the lateral portion of your elbow while you're doing this. If you are, then you're not quite ready for this type of strengthening, and you should wait for another week or two before trying to do this. But this type of strengthening is so important to getting complete healing from tennis elbow because your wrist extensor muscles, they got overstrained for a reason. You overused it, plus your wrist extensor muscles are weak. So you can go ahead and do this slowly, about 10 times, focusing on controlling the descent of your wrist, as well as making sure that you're not experiencing any pain. If you are on the later phases, like 1 to 2 weeks to 3 weeks after your initial injury, you want to go ahead and add a weight. I do not have any weights on me right now, so you can also use a water bottle or a can of whatever it is, but just make sure that you are not feeling any pain or strain in that elbow. Moving on to our last strengthening exercise, we are going to do scap squeezes, working those mid-scapular muscles, getting them nice and strong so that you can hold your shoulders back and have an upright posture. You want to go ahead and do these nice and slow. Make sure that you're not elevating your shoulders up, so your shoulders are not hiking up towards your ears, but you're just bringing your shoulder blades back. Go ahead and do 10 of these.
And there you have it. You have just learned some basic tips and tricks of how to take care of this elbow problem. And just as a reminder, this is not a replacement for seeing a physician or a physical therapist, because there isn't a one cookie cutter program for everyone for tennis elbow. The best thing you can do is to go see your local physical therapist and get a program that is specifically designed for you. If you haven't subscribed yet, go ahead, join the family, but I will go ahead and catch you next time. Peace.